Hello, everyone. Welcome to another episode of the ACE podcast series where we discuss critical public health issues. We try to provide solutions to policymakers, to government, and to implementing partners. On today's episode, we have a very important topic for conversation, which is counting every child, why enumeration is the game changer for reaching the unreached. But before we dive into today's conversation, I would like to remind you to please share and subscribe to our YouTube and Spotify platforms where we will be posting these episodes. And don't just listen, please help us reach the unreached by doing these activities. Remember to share, and then subscribe to all our platforms. I have two important guests with me, or two very wonderful guests with me on today's episode. On my left, I would like to do ladies first, is Deborah Okeje. Deborah works here at ACE as a programs associate, and she has worked across several projects across almost every state that we have worked in. I think at every state where we've gone to implement, Deborah has been there. She's actually ACE's most traveled staff. Officially, she would be, having this conversation with us here today. Welcome to our show today, Deborah.
Thank you. I'm delighted to be here.
That's great. We have on my left Uthman Alawo. Uthman is a programs analyst here at ACE. Uthman is a very wonderful young man. He has worked on several enumeration projects for polio, for SOTU, across various states. And Uthman has a wealth of knowledge that he would like to share with us today. Welcome to today's episode, Uthman.
It's good to be here.
Thank you very much. Before we dive right in, Nigeria's last official census was conducted in 2006, placing us at about 140 million people. Nearly 2 decades later, we are still planning schools, hospitals, and budgets with outdated figures. And what is the cost of this? Regions are either starved or oversupplied with resources that they don't need. In 2022, ACE enumeration exercise in just one state, Gombe State, uncovered over 70,000 children under the age of 2, more than 94,000 children under the age of 5, and about 114,000 women of childbearing age that have previously been missed during health campaigns and implementation. Now, that's just one state out of 36 plus the FCT, right? Now, imagine what have been missed previously. Deborah, I would like to start with you. What does it truly mean for a child to be missed? And what impact would it have had in their life if they were actually reached or counted?
Yeah, what does it really mean for a child to be missed? It means a lot to the child, right? Because the child, no one knows that child exists. Yeah. No one can certainly identify that child resides here or is born into this family. So if they are given any social welfare services, the child won't have access to it, and they are now laid back. So where their peers are moving forward, they are drawn backward. And what that means for the child is that it costs them time. It costs them health, welfare. Like, for example, for the polio vaccination that keeps on going repeatedly, because we don't know where those child exist, they might be living in hard to reach locations, and the assumption is that no one resides there. And also, unfortunately, that child exists, but the child doesn't have access to the vaccination that is currently going in the next community, or maybe in the next, and that already leads the child to either death or maybe some deformities that happens because they did not take the welfare services that are available at that time.
Yeah, I hear you, Deborah, and I think I'll wrap that up with saying that it costs the child their future because there's no guarantee that they exist. They cannot be reached with social services or amenities. It means that their future, like you said, it costs them time. That means what it would take a child that was reached maybe 3 years or 5 years to achieve, it would probably take a child that has been missed 15 or 20 years, if not more. Right? Yeah, that's a great way to start. I would like to go to you, Uthman. We've heard what it cost the child from Deborah, but what we'd like to hear from you is what does it cost the community, the society where that child resides?
That's a very big question. So the whole approach is people live in a community, right? What I mean, like people make up the community, right? So if a community is supposed to be part of what we want to take care of, and then they don't have access to particular resources based on some missing data. What that means is like we most likely not going to provide the intervention that is appropriate for that community on time. And then you made mention earlier that in Nigeria we are still living in the estimated number of 2006. And that is about 50, like 90 years again. What I mean, like, it's going to affect the budget for that particular community. It's going to affect the expected intervention for that community. It's also going to affect, okay, what kind of policy can we make to take that community out of poverty, if that is the case, right? So in the long term, right, the community will not be part of people that can contribute to the growth of what we want to see in terms of social welfare generally. Maybe health, maybe education, maybe agriculture in some cases as well, right? So there's going to be a lot of challenge for that community because they are not among the data that we have. No quality for them.
That's great. And this reminds me of a story during one of our documentaries where in Katsina State, there was a man we interviewed, and he said that he was playing with his peers in his compound, and he just fell. He started shouting, and they found out that he couldn't walk. It was just, he was with people, with his peers. Now, imagine that guy 5 years later, where his peers would be and where he would be because he didn't receive polio vaccination when he was supposed to receive it, and that affected him. That has truncated his future in a way, right? I would like to dive into the work we have done in enumeration, and Deborah, I would like you to talk to us about that, right? From your perspective, how has ACE enumeration work redefine, the way we reach children at the last mile?
I think we had conducted this enumeration exercise in Gombe, and we identified 7,000 children which were missing. So we also conducted this enumeration exercise just in the last couple of months, right, in Kebbi State, and we helped us to identify about 3 million children in total. And across the entire states that were prioritized for the exercise, about 7 million plus children were identified. That's it. And 64% of those children are zero dose. Wow. So you could see that 64% are zero dose, which means they have not received any form of vaccine, or they have not received Penta-1, which is the one that we usually use to rate that at the health sector. So you could see that they are, with our support at those locations, we're able to support in identifying these children, and we have used the AI tools and DSS tools to document where they reside. So for future interventions going into the current interventions that are being set out are the SAMAN project, the MAMI project, and also campaigns, routine campaigns that are being implemented. Those children are now prioritized. They are now the priority for now. And at least maybe in the next couple of months, if you check the data, you would see that we have lesser zero dose children in those locations. So that helps. So with our support and also other collaborating partners and the MPCD, you could see that child is counted, or those children, because that's a lot of number, for 64%. And just 12%, just to let you know that 12% of those children are the ones that are fully vaccinated. So there is no consistent, consistency. Maybe if they are received, maybe they were prioritized last year, in this year, you see there's no routine check on who and who have we reached. But with this data now available, every resources that is deployed now is now targeted, is prioritized, and those children are the major priorities. And like in years to come, you see the benefit of that to the entire society, just as Uthman has mentioned.
Thank you so much, Deborah. That's a lot of numbers. 64%, that's a lot. Uthman, I would like to come to you, right? For me, IV, I would describe it as a 3-course meal. Identification being the starter, enumeration being the main meal, right? That shows the importance of enumeration in that whole process of identifying enumeration and vaccination. I want you to then deep dive into the importance that enumeration play in not just reaching out to children, but even in how we design these interventions.
Great. Thank you so much for the question. I mean, we've talked about the people. Now let's think about, okay, what are the processes we need to get it done right? So if, let's say, I basically is identify, E is enumerate, and the V there is the vaccinate. So I'll just be using the IEV for people to be able to understand what I mean. So the high there, if we don't identify and locate people that need to be counted, that's going to be a problem. What that means, like, we don't even have access to them in the first place. Now, before even proceed to say we want to count them, that is the first part. We need to identify people before we can count. Now, let's say we want to count, and then what we are counting is inappropriate. There are weak data, weak informations for us to make decisions, to make interventions happen. That's a lot of challenge. Because what that would mean is if government just wake up one day and we want to design a particular policy to implement, like for strategy development, there's not going to be what to back their intervention to say, oh, this is what we want to implement, but there's no number, weak numbers. Let's say we're talking about 2006. And this is supposed to have been done about 2016.
Every 10 years,
Every 10 years. And then we are here again discussing what's supposed to happen about 6 years around the corner. So there's going to be a lot of challenge. We can make informed decisions. We can make measurable impact. In fact, we cannot even distribute our intervention equitably across board. So those are the challenges I think is come with enumeration. Yeah.
Wow. That's a lot, right? Like we cannot make measurable impact because again, it is not just about doing. It is about knowing if what we are doing is actually making impact, if it is making meaning to the lives of the people where we are carrying this intervention. But then I would like to know, Deborah, from your point of view, what are the biggest barriers to enumeration, right? Because again, there are reasons why these children have not been counted before. There are reasons why interventions haven't reached them. So what would you say are the biggest barriers to enumeration?
Yeah, for enumeration, it's cut across so many barriers. There's cultural barriers, there's geographical barriers, there's also insecurity as well, and there's also technological barrier as well. So I would start with the cultural barrier. So cultural barrier here means that, to me, when I hear the word culture, it's a collective habit. Some people have identified this as their identity. So they want to be represented this way. And they feel, so it sort of creates a defense to some form of new ideas when it comes. So that's the impact of how those cultural barriers, like where women can't go to health facilities except maybe their husbands are around, or cases where women prefer home birth services than going to health services. Because when you go to a health services to give birth, if by right, just as they are trying to do digital health or digitalize health, when we have a birth registration digitalized system, that would help us to know how many children are being given birth to, and they are being documented. And the national, that's NIMC, is responsible for collating this information, and automatically when the child has come into that, you're already being counted. People already know who you are and know where you reside. So that's how cultural barrier can make you not even know that there's a child. Another one is geographical barrier, where they reside. It's okay for you to go to urban cities and identify that a child is here, and it's easy for people to look out for one another in those kind of scenarios. But when you go to rural cities, like the last, as you say, I'm the most traveled staff, the last supervision that I did, I was really, really shocked on where the last campaign was prioritized, because the last in-between round activities was for hard-to-reach locations. I could remember being stuck in the community where I could not know, I can't speak their language, but I had to enter bike and go into places, and I was literally scared because I had to go into deep cities, and I saw where people reside. Like, it's like an outskirt, and left, right is just bushes. You can't, so you could see how that distance alone will make people not want to go there, because people are already scared of their life because of the insecurity. So you see where insecurity comes in. People will not want to implement activities there because they feel that their life, it's being laid back or something because of what's currently going on in the society. So that's how much these barriers can affect a child being counted, and they don't even have access to these services, even when it's available.
That's very very key. I remember when there was a documentary I was shooting for. It was around flooding, had to do with flooding, climate change issues. And we went to a particular community. We got to a school in the community that it was a school like actually built bricks and wall, and it was empty. And this was around school period, right? And two things affected them, like you said, in the geography. One, insecurity,
Yeah.
right? I know insecurity can make it hard for us to go into some facilities or some communities to count children. Insecurity is a very big player in missing children, because as somebody who is implementing a project, you have a family too.
Absolutely.
Let's start with that. Your family, you would think of your family that would miss you because you are going into a community to implement some project, and then insurgents or what they call them, bandits, come there to carry you. So insecurity is one of the issues that I know affect unreached population. I would also say, to a point, maybe they are the policymakers in some communities, are not even really interested in what's happening in the communities.
I think you just reminded me of some challenges we had during the enumeration exercise. You could tell that some community leaders restricted the act of counting children. That I was not informed, because one thing I understand that the enumeration exercise is a collaborative effort, and when it's owned by the community, it's easier for you to actually count the children. So we also experienced those mitigations or limitations during the field.
I know the conversation is going a bit towards like how we want to like move on and get a bit of intervention done appropriately. But I think this actually brings me back to the project we implemented across the 17 states in Nigeria, in the southern region of Nigeria, where we were trying to revitalize PAC services, right? I remember when we were designing the landscape assessment for those communities, when we were trying to like, okay, what are the people we really need to talk to get information? One of the challenges we faced then was around how to reach community. In fact, like one of the things that actually top our list during our landscape assessment, because what happened then was like, if we say we want to go and meet these people, we want to provide for them what they need to do. We want to take in their data to make informed decision. But the road network that get to them, we can't even access them. They are going to be missed out, right? That's a lot of issues. That's one. It's actually one of the geographical barriers I want to mention, just to how to what she has mentioned earlier. The other thing I also want to mention is around technology. In most of this community, right, there is a lot of poor internet connectivity. Like, let's say we are going to this particular community, they don't even have access to, say, infrastructure for us to take in their data into a safe platform, like a digital application or mobile, where we can now document, sync those information, and someone here, somewhere at maybe Ministry of Health, Ministry of Finance, they can make informed decision based on those things. So those challenges around technology, geographical location, and cultural, it's a lot of factors we really need to discuss. Yeah. They move around as well. Yeah, that's absolutely right.
Thank you so much. So we've established a couple of things from geographical location to insecurities. I mean, it's so funny that across the north and south of Nigeria, if we talk about geographical barriers, it can be different things. Like it can be different things. For one geography, it might be insecurity. For another geography, it might be road network. And but that's great. That's a great point we've made so far. What I want us to talk about now is from our field experiences, right? How do you think we can scale up to strengthen the national system? Right? How do you think we can help strengthen enumeration nationally?
Can I go first?
Okay.
Right.
Okay. Yeah.
So to strengthen enumeration appropriately, so that we can reach more people, I mean, there are a lot of approach we are trying to use, bring in technology, use AI to count people, right? But why can't we leverage on people that live in those communities? Let's bring them on board. I mean, community leaders from those communities, they know better. All we just need for them is like, okay, let's give them a bit of capacity building so that they can efficiently do those work, right? They live in that community. All we need from them like this data. And another thing is, we've trained them, we build their capacity, right? It's ownership. If at any point where we realize that they realize actually because they're from that community, like, okay, new children are now growing around the community, new birth, a lot of situations like that, they can as well call the attention of the government. Oh, we understand that we're having a lot of challenges. You have empowered us in the previous enumeration you did, but we think you need to come again. What are the tools they want to use this time around? Is there a mobile application? Is there a digital tool? Is there an AI? But don't forget, a lot of efforts still need to come in terms of collaboration across board. Just to mention this a bit, is like I'm aware, like Ministry of Information and Digital Economy, they're also trying to lay fibers across the LGA across Nigeria. What that means is people will have access to internet when they are done. We are not sure when that will be ready, right? But when that is ready, it's also going to support other ministries to do a lot of intervention or focusing on what they need to do appropriately. Yeah.
Thank you so much. Deborah, would you like to take a stab at that? How do you think we can scale up, to help Nigeria and, reduce the population of unreached children? I mean, when you were talking, you mentioned about 64% were 0 dose. They've never received a single dose of vaccination. So how do you think our work here at ACE can help communities to, can help the government and maybe implementing partners to scale up?
I think it's beyond just collaboration and working with the people within this community. We observe there is a divide in terms of capacity of people within those communities. So it will take a lot of time to build them into the capacity. So what I would advise, as at now we are, is to do some integration approach where you have the people that have the capacity to use the digital tools and then work with the community members. I think we did that in the just recently concluded IV exercise across the 6 states. We used local guides. We call them local guides. Local guides are people that reside in those communities. So what they helped us do was that when you get into a household, if I want to get into a household, they will be the one to speak to the leader of the house and sort of makes the exercise seamless. So that's how much collaboration comes. So I think in addition to that is integration, building the capacity of people within those regions to take hold this responsibility so that it can be sustained over time.
Usman, when you were speaking, you mentioned digital tools, AI, to help us in enumerating better. What do you know of any digital tool, right? Or how would you advise? I mean, recently there've been a lot of conversation around digital health, how we need to improve our digital health, because we believe that with good and better digital health, we'll be able to get more coverage, we'll be able to reach more people, right? So before we even talk about the specific digital tools, right? What role I would split it in 2 ways, to the government and then implementing partners play in ensuring that we first of all adopt digital health, because we need to adopt it very fast. What role do you think? Okay, I think you should speak about the role of the government, and maybe Deborah will speak about the role from the implementing partners. Do you think we can play in helping ensure that we adopt digital health very fast to help scale up?
That's a very big word for me. Yeah, so talking about what governments really need to do better to improve and reach more children, right? I think it's pretty clear. Let's say we can't just sit back, say like things will get done by itself. And if we need to make something really done, we need the input of government, considering the fact that we were able to, they can get things done in terms of when it's come to voting now. I mean, they go to all those remote communities and then they get voted. But when it comes to intervention, it becomes a challenge. But one thing that is very, very clear is, can we say government bring in like experts together to say, oh, we are trying to reach a lot of people, right? But these are the things we've put in place because we want to achieve our purpose. Let education be available for people. I mean, we're supposed to be everybody's right. Of course, health should be available. But another thing that comes to mind is, how was it easy for financial institutions to get to all those communities? Because I remember when doing a lot of intervention, anytime we need to bring them on board and we ask for data, for them to submit data, we don't get that easily. But when we request for them to submit their account detail, that's very easy for us, So what that means is like, how come that is easy? So I think we also need to adopt what the financial institutions are also doing. What I think government should do is bring in all those financial institutions, maybe banks that are working in those remote communities, to take lesson from what they've done better and how we want to integrate that into health intervention.
That's actually very powerful. So now he spoke about the government, and I quite agree with that. They need to, bring in. Institutions have done it. That's the honest truth. Institutions have done it. So it's possible, right? So they need to, collaborate with these institutions to do this. Now, on the part of donors, implementing partners that want to, help give us a good public health landscape, what do you think they need to do, to ensure that our enumeration exercise help us to reach the unreached?
So for all the part of implementing partners, it's just for them to work with the government and not work alone.
Yeah.
Because I think that's what matters most, and also work collaboratively, not work divided. You could see, I think, thank God for the swap approach that tried to limit the same interventions by different people happening either between times concurrently, and so that's leading to duplication of effort. So what that would help us do, if the partners are already trained or have an understanding of the same goal, just as he had said, in terms of using the digital tool to conduct this exercise. So what the implementing partners can do is to build the capacity of people that would lead on these things, so that when these interventions are being set, when these infrastructures are being set in place, it doesn't just go back to the usual things are being set in place and no one is using it, and there is no plan for SNP. So I think the part that implementing partners play is, because they are experts in terms of problem solving, they're able to be in the long run while these interventions are being done in terms of digital health infrastructure. And I think there are already tools that the implementing partners have supported in developing. I think the ComCare and the FinOt have played a huge role in making this. So those apps actually helped. It's just I said, there are other limitations in terms of integrity from people in those communities in conducting this exercise. So those were the recurrent issues. So that brings us back. The government has a role to ensure that the community leaders, traditional leaders at those locations, take responsibilities for the right things to be done.
Thank you so much, Deborah. You like to say something?
Yeah, I want to say something actually. So we've spoken about government, we've spoken about implementing partner. It's also good for us to think through what are the sustainability structure, right? Government has done their part. They bring in people. Maybe there is not enough resources to do all those interventions. But donors are now here, implementing partners are now here. Oh, let's help you to do this. This is what we are here to solve. Are there strategy where we start thinking around, okay, what are the sustainability structure? Donor might decide like one day we are not implementing this location again. Maybe it does not align with their interest any longer. But that intervention must not stop. If we don't want that issue that has happened to reoccur itself. So while we are doing integration of people from that community, we are building mobile app, government are developing policy, our implementing partner are providing resources and allocations. It's also very good that, okay, can we say tomorrow if we are not here again, these people can still actually take in that habit, that behavior that we've inculcating them, so that this can be sustainable for subsequent implementation.
All right, thank you.
I think the key word there is capacity building.
Absolutely.
Integration is in two ways. Integration in terms of capacity that we need to build, right? We need to build capacity. Integration is also bringing all the efforts together, efforts of different implementing partners across different states, efforts of even the government, you know, bringing them together to ensure that, we achieve one goal. Very quickly, we are beginning to wrap up. And as we wrap up, I would like to ask one important question, and I will ask it to both of you. So whoever would like to go first can go first. But if Nigeria was to adopt ACE's enumeration approach nationwide, right, what impact could that have on achieving the slogan "Leave no one behind"? If Nigeria is to adopt our approach, our enumeration approach, how would that help us to leave nobody behind?
I would not want to say ACE's approach. It's a collaborative approach by the MPCD that led it, which ACE played a role in also designing the strategy together with other implementing partners. So I think how would that approach impact us reaching every client is just the same way we did it in phases. So we conduct enumeration exercises in phases. And I think the approach that was set in place was actually structured enough to reach these children. However, were there some limitations in terms of most of the information was also in context of ownership, so which was a problem from the community. But I think the only thing that we need to do differently, just as ACE does in the edutainment approach, is to ensure community own this intervention, where they are involved in this process and they are trained to know what to do. In addition to that, can be just as we did a project as regard birth registration, digitalization of that. If that is also put in place towards sustainability, that already helps solve the case.
Okay. Uthman, I would like to bring that same question to you. If Nigeria were to adopt ACE's enumeration approach nationwide, right, what impact could that help us achieve in leaving no one behind?
That's very, very thoughtful, because what I'm thinking is, what happens, say, ACE gets bigger, very, very big, and then we get global, and then we might not be able to implement at state level. Are there other organizations that can come in to step into like what we've done in the past, taking lesson from what we've done? What I think is also very important is there possible where we help government to develop like a long-term strategy document? Let's say in the next 5 years, these are the things that we have as a consulting organization that we have. These are the things that we think could work. These are the approaches. These are the recommendations. So any organization taking that lesson, like we can now plug in all those knowledge, what we've done based on our, we've piloted in Gombe. We did that in Gombe. Yeah. We did a bit of that in Kebbi State. So anybody that at this point, maybe we are experts in that region, in that area for now. So what I do, like, we document those plan with documents, right? And then we share with people. We make it open source for people. You can just download, read about it, and then you can see how your contextual approach can be applicable in other states. Yeah.
Thank you so much, Uthman. So the word there is documenting our process, such that again, remember that we are documenting in the context of one state,
exactly,
but also make it to be easily, so that it can be contextualized in a different community.
Absolutely.
But again, the approach has to be the same. So it's important that we document, because again, if you don't tell your story, people may not be able to see your record, see your track record of how things are done. So it's important that we document, and as Deborah said, create a sustainability plan whereby, okay, even when these communities can come in after intervention is done and we've gone, these communities can still, help themselves. These communities can still grow through what we've done. This has been a very interesting conversation with both of you, and I would like to say thank you as we wrap up. But before we wrap up, I would like to say, if you had the ears of, who would I say? Maybe the Minister of Education today, and you want to talk to him about enumeration, Uthman, what is that thing you think you would tell him?
So the first approach is like, what if I make your work easier and then your impact being known? It's very simple. So if I want to make your work easier and the impact of your ministry, the people you are leading, known, why can't we know the number of people within that particular location? Right? So what that means is, for your work to be known very well, we don't even know the number of people who want to interview. Like, that makes a lot of sense to the person I'm speaking to. The person leader is like, that's a very serious and a big challenge for me to address. If we don't address this thing, the education will not be achievable, which maybe the Minister of Health. The health might not be easily accessible, right? And maybe a financial institution might not get to all those locations as well, right? What I just like to mention to the person is like, your work needs to be easier, but I have the answer to what you need to do, right? Let me help you to structure out an enumeration process that is going to make you reach enough people within, maybe across Nigeria at this point.
Thank you so much. Deborah.
I think I will speak from the data point.
Okay.
We already have a data that speaks on how many children has been missed in terms of health services. So I can use that to contextualize for the educational part, where they'll be able to know these are the number of children that maybe have not had access to the basic education. And this is the required number of school building that is required. So just to contextualize what has played out in the health system, to see how impactful these strategies can be redefined for the educational sector, and speak to him based on that data.
Okay, thank you so much, Deborah and Uthman, for today's episode. It has been wonderful speaking to you guys. I've learned a lot. The data we have called on this is mind-blowing, but it speaks to one thing: the government, implementing partners, everybody needs to do better. Exactly. Because again, if we don't know the number of people we are trying to reach, how then are we sure that of the impact that we are even creating? Are we just doing this project or these interventions just to tick the boxes, or are we trying to actually impact life? If impact is what we are trying to get at, it means that enumeration is important in reaching the unreached. Thank you so much, everyone who has tuned in today. I would like to also remind you once again to remember to subscribe, to like, and to share these videos so that we or these conversations can reach the unreached and help improve health outcomes across Nigeria and the global space. Thank you so much for tuning once again. My name remains Precious Akpan, and I had Deborah Okeji with me today. Thank you for coming, and Uthman Alawo. Until next time, when we bring you another episode of the ACE podcast series, please take care and remember to keep spreading this message. Thank you.
Bye.